Good afternoon and welcome to today's Lunch and Learn webinar for the Iowa Pediatric Mental Health Collaborative, Helping Parents Manage Common Behavior Problems, a deeper dive into behavior basics, presented by Dr. Kelly Schieltz. My name is Kathy Dixon and I'll be hosting the session today. Before we begin, I'll cover a few housekeeping items. The webinar will be recorded and made available for viewing on our YouTube channel. So please allow 1 to 2 business days for the recording to be made available. I'll share the link in the follow-up email. Following the presentation, we'll have time for question and answers. So please use the Q&A feature in the webinar toolbar and to submit your questions, and we'll answer as many as time allows. If you have a concern or are experiencing any technical issues, please send me a chat using the chat feature. During the session, I will attach a handout in the chat section with instructions on how to claim CE credit. This information will also be sent to all attendees in the follow-up email after the webinar. So without further delay, it's my pleasure to introduce Dr. Kelly Schieltz. Dr. Schieltz is an assistant professor in the Stead Family Department of Pediatrics at the University of Iowa. She's a licensed psychologist and a board-certified behavior analyst with over 15 years of experience evaluating and treating in brief outpatient clinic severe and challenging behavior displayed by children with and without developmental disabilities. Throughout her career, she has worked on a variety of federally funded and state-funded research and service grants that focused on training parents and school professionals on behavior analytic procedures in vivo and via telehealth. Her research interests include 2 areas. First, she trains parents in their homes via telehealth to conduct treatment procedures to decrease the occurrence of their child's challenging behavior. Second, she evaluates behavioral persistence and treatment relapse for both challenging behavior and academic behavior when treatment is challenged. So with that, I will welcome Dr. Kelly Schieltz and turn the session over to you.
Great. Thank you so much, Kathy, for that introduction. And good afternoon, everybody. I am really excited to be here today to present a deeper dive into the behavior basics as it relates to common behavior problems that parents experience, like tantrums, noncompliance, aggression, etc. I attended the talk that Drs. Burgundy, Pelzel, and Kopelman gave to this series back in January, at the talk they did on problem behavior. So I thought they did a really excellent job of giving a broad overview for those of you who attended. And so today what I thought I would do is review and expand on some of the components of their talk. So that's where the deeper dive comes into play. So for this talk, I don't have anything to disclose, but my objectives for you today are that you will be able to explain the role of function in behavioral assessments and treatments, that you'll be able to describe pros and cons, benefits and limitations, whatever word you want to use, of punishment and reinforcement strategies, and that you'll be able to identify at least one do and one don't strategy that is based on behavioral function. So before I get started, I do want to thank those of you who submitted questions prior to today. It was helpful to see these questions, and on the screen are several of the ones that were sent to me ahead of time. So it's helpful to see what questions like come up for you, and helping me think about how to approach what I'm going to talk about. So as I present today, I do hope to answer some of these questions. Some I will likely not be able to answer fully for you because it's not necessarily in my area of expertise, but hopefully I can give you some guidance on maybe what that might look like or the words you might use to do some searches of your own. And so any that I don't get to, as Kathy mentioned, feel free to put them in the chat, or maybe it wasn't the chat, it was some other feature in Zoom. I don't remember what they are. But feel free to put in your questions and we'll try to get to as many as we can at the end. Okay, so for those of you that did attend the talk on behavior in January, you might recall Dr. Kopelman presenting this particular 4-step sequence that was related to his approach to problem behaviors. So the first step he discussed was related to the determination between education and treatment of problem behaviors. So one major factor in making this determination is the developmental appropriateness of problem behaviors. So we do want to keep in mind that all children do engage in problem behavior. We engage in problem behaviors from the time we're infants, and then all through the developmental stages. Problem behaviors, behaviors of concern, those change over time as we develop. And so all of that is pretty normal. But so behaviors that we might think of are tantrums, aggression, destruction, and tattling, bossiness, refusal. These are all common behaviors that happen at very different stages of children's development. So, for example, when we think about children between the ages of 1 and 5 years old, tantrums are common, and they tend to occur about once a day, maybe for a duration of about 3 minutes. So if that's what we're being presented with when parents come and say, I'm really concerned about my kid, they're engaging in these tantrums, and we ask a few questions and they're telling us, well, it only happens maybe once a day and for brief periods of time, we're not going to get super concerned about that particular behavior. And so that's going to be somewhat normal for that child's developmental stage. So in that case, we might be thinking that education and monitoring the behavior is probably the best route to take to reassure the parent. This is okay, it's normal, but please keep me informed. If it gets worse, let me know and we'll take maybe a different tactic or we'll take a different route on that. But in contrast, if we have tantrums, if the parent's saying, well, we have tantrums, they occur multiple times a day and they last for 15 minutes at a time or even longer, then we might begin to think about, okay, maybe there's something else that's needed, and we start heading down this treatment route because it's something that needs to be addressed. It's causing a lot of distress and concern in the home environment or school environment, and so it's something that maybe we need to look into a little bit more and address more specifically. So with that, when we think of going down the treatment route, so one thing Dr. Burgundy highlighted back in January was that the first line of treatment for behavior problems is therapy. She further indicated that medications are not the fix for problem behaviors. Rather, they help with symptoms. So this isn't to say that medications should never be used. It's just that they shouldn't necessarily be the first line of treatment. And when we think about in the research, there's a lot of research to suggest the combination of medication and behavior therapy often works well together. The other thing is, if behavior therapy alone is not successful, sometimes what the medication can do is kind of lower the threshold to allow the behavior strategies to make some impact, with the idea that hopefully we can fade those medications out over time. So again, like Dr. Johnson mentioned, we shouldn't necessarily be looking at medication as the magic bullet, or that it's the magic pill that's just going to fix everything, because it likely will not. It may address some of the pieces, but you're going to need some of that behavior therapy in there as well. So then when we think about therapies, Dr. Pelzel introduced a variety of manualized therapy approaches and emphasized that each of them target different age groups and behavioral concerns. So for example, in the parent management category of behavioral therapy, we have parent-child interaction therapy, or PCIT, and Incredible Years. And these particular therapies target young children who tend to have milder problem behaviors such as tantrums and refusal. And then we also have a parent management training program, the Organ Model, or PMTO. And this particular therapy is going to target your school-age children, and typically those who have more ODD type behaviors. And so, like with this little image here, Michigan has a PMTO program that they use. to help address those things. I looked, I don't think Iowa has anything currently, but I could be not finding what I was looking for when I looked. So those are some of the different therapies in the parent management category. When we get into the family therapy category, we have things like multisystemic therapy that tends to target juvenile offenders. So with the work that I do, my focus tends to be on the problem behaviors that appear to be non-responsive to common parenting strategies and parent management therapies like PCIT and the incredible years. So my work does not tend to focus on the ODD population, which often includes our typically developing adolescents and young adults. So because my focus is more on, is not on that, ODD type population, those types of behaviors. When we talk about like self-injury, I don't focus on the suicidal types of self-injury. I focus on other forms of self-injury. So because of that, today through my talk, I'm going to focus on how we assess and treat common behavior problems for young and school-age children. Typically, this is going to be the kids who are under the age of 10, who are typically developing, but then also children and adults who have developmental disabilities. So I tend to focus on across the age range, if they have a developmental disability like intellectual disability, Down syndrome, autism, those types of things. Okay, so when parents are presenting a concern, and that concern is behavior problems, and we've determined that the occurrence of the behavior problems is beyond normal developmental expectations, we need to begin considering the behavior's function. And so I'm going to use Dr. Kobelman's imagery here for those of you who attended in January. So to use his imagery, we become the detectives to understand why the behavior problems are occurring. Understanding the why provides us with guidance on how to approach treatment of the behavior problems. So in this way, we're not so much concerned about the topographies or the form of behavior, such as aggression versus tantrums. Rather, we're concerned about any and all of those behaviors, but we're concerned about the function that those behaviors are serving. And so, unfortunately, I think it's important to keep in mind that there's not particular interventions for a particular form or a topography of behavior. You'll see things like the aggressive child, and you have books on that. And while those may work well and good for typical forms of aggression, when we get into kids who display aggression where the typical strategies are not working, then those books, are not really all that useful. And so then that's when we need to take a step back and really begin to understand the function of the behavior. Why are those behaviors happening? And start to approach it in that way. And so targeting that function rather than just that it's aggressive. So hopefully that makes sense to all of you. So as I just mentioned, behavioral function tells us why a behavior is occurring. There are many reasons why a behavior occurs, which can include factors related to biology and physiology and genetics. It can relate to factors related to development and or the environment. So my particular detective work focuses on the environmental reasons for the occurrence of behavior problems. However, I do want to mention that I do assess for potential biological reasons such as constipation, ear infections, sleep issues, etc., because those biologic events can trigger or increase behavior problems. So when those biologic events are identified as contributing factors, I refer, because I'm not a medical provider, I'm a psychologist, so I refer to a medical provider to assess and treat for those particular events. And if the treatment of the biological issue is reduced, or if treatment of the biological issue reduces or eliminates the behavior problems, then I don't provide additional behavioral support, right? Because what was happening was we're constipated and now I'm lashing out, right? Because I feel uncomfortable or I'm in a lot of pain, those types of things. On the other hand, though, if behavior problems are continuing to occur after we've treated the biologic issue, or we've ruled out that a biologic issue is not actually present, then I'm going to start focusing on these environmental influences. So what is happening within the environment that is resulting in the continued occurrence of these problem behaviors? So to understand the function of behavior problems from an environmental perspective, we use an operant model to assess for the events that trigger, or what we would call the antecedents, and the events that maintain, or the consequences that we implement relative to the behaviors of concern. So gathering examples of the antecedents and consequences help us to identify the patterns of what the child is getting from engaging in the behavior. So one of the first ways that I get this information, which all of you can do, is I interview the parents using this ABC framework: A for antecedent, B for behavior, and C for consequence. So where I start is I start to ask about the topographies of behaviors of concern. So for example, parents will indicate a variety of things. So they'll say things like, well, my child engages in refusal and tantrums, or aggression, or destruction, or elopement, etc. In most cases, a large variety of behaviors occur, and any of them are likely to occur. So I don't get too worked up about which ones are occurring and then the order that they occur in. I just try to gather what are all the behaviors of concern that you see. And then I go from there. So then after I've kind of gotten what the behaviors look like, and I'll ask about the behaviors, what do you see? And so for aggression, I might get some more examples, specific examples. Are they hitting, kicking, spitting at other people? Destruction, are they ripping paper? Are they breaking TVs? What are they doing? What do the tantrums look like? Just so that I know what we're kind of looking for if we were to see it. Then after I get those, I then ask parents to tell me what's occurring before the behavior occurs. So what are the triggers or the antecedents to these behaviors? So common examples that we'll hear about include the following. When I tell them to pick up something, I tell her it's time to stop. When I tell them no, I get that one a lot. When we go to the store, when I'm with a brother or sister, when I'm on the phone. These are all common things that we'll hear about that are happening before these behaviors happen. So I tell them to pick up, and then the child refuses and tantrums. So after then I figure what's going on there, what's triggering those behaviors, I then ask the parents to tell me what their responses to the behaviors are. So what happens when their child engages in problem behavior? Understanding the consequences to problem behavior provides insight into what is strengthening those behaviors. So it tells us what is making those behaviors continue to occur. So for example, parents will tell me the following. I give up, or I do it for them. I let her keep doing it for a few minutes. I give in. I get a treat or toy for him. I have to stop and see what she wants. I yell at her. So I get all this, right? The A's, the B's, and the C's. And when I have this information, I then begin to look at what these ABC sequences are to determine what the function or functions might be, because we can also have more than one function. So again, the function is telling us why the behaviors are occurring. So from an environmental perspective, we're thinking of three primary functions. We're thinking of gaining or maintaining attention from others. We're thinking about gaining or maintaining preferred items, activities like toys, food, or even being outside. And we're also looking for something related to escaping non-preferred items or activities, like getting out of a task or getting away from icky food we don't want to eat, or getting away from attention that we don't like. So all three of those, attention, toys and activities, and escape, those are all functions that we call social functions, meaning that they are influenced by events that actually occur in the environment. So things that we do, interactions with others, interactions with items, all those things. So things we do in the environment. So if we look at the examples from before, we can hypothesize the likely functions for these. So for example, we have refusal and tantrums occur when they were told to pick up. And what the parent does is they end up doing it for them. So in this example, we're going to hypothesize that escaping the demand is the function of that behavior, for that behavior. The next example, so aggression occurs when they're told to stop, maybe playing with an item, but then they're given more time. So commonly in my clinics, when I tell them to get off the iPad or the tablet, right, or the TV, it's time to stop, time to put it away. They start hitting and kicking. And so then what the parent does is, well, I just let them stay on the tablet or iPad. So in that instance, we're going to hypothesize that it's to gain or maintain access to that item or activity that they enjoy. Similarly, we see destruction when they're told no, and the parent then gives in. Again, this is going to be hypothesized as a gaining or a maintaining of the item and activity. Similarly, I'm sure many of us have had this experience. We take our kids to the store. Maybe we've told them no, they can't have something, but also just being in the store. And so they take off running or they tantrum. And then we give them a treat. We buy them that candy bar or that lollipop, or we buy them the toy. And so when this sequence continues to occur, so each time we go to the store, these behaviors happen. When we see this pattern happening over time, we're going to say, okay, we're going to hypothesize that the function of that behavior is to get access to that item or activity. The next example, so they tantrum when mom or dad or other caregivers are with a sibling. And then what happens is the caregiver stops to see what the child wants. So in this instance, we might hypothesize that they're trying to gain attention from the caregiver. And then finally, we can, in the last example, they engage in aggression when somebody's on the telephone. This happens a lot, right? Mom's talking to someone on the phone and the kid starts hitting mom. And then what happens? I yell at her. So again, we're going to hypothesize attention. And the form of attention, when it gets to attention, it doesn't matter if it's positive attention or negative attention. To a child or to anyone, it's still attention. And so we have to keep that in mind, and we have to be thinking about that. So as a recap, the most basic environmental social functions of behavior are tangible, attention, and escape. I'm going to show you some memes that I hope help you remember these. I think using memes are a fun way to keep these in mind. So this first one, we don't bite friends. I know that was my way of ending things. So we might also think about this as a way to get something from a friend too. So kids often bite each other, right? So they're playing and I want that toy. And so I'm going to bite you because my friend is going to give it to me, right? I can think of this when my daughter was younger. She would, the daycare provider would give her and another child like a cracker for a snack, and she'd scream her head off so that the other child would give her his cracker. And so really good ways, right, to get what we want by engaging in these problematic behaviors. A couple other memes. So this one, Kermit is saying, well, maybe he runs away because he likes you chasing him, but then that's none of my business. Or this little girl who's in the picture, do you want me to raise my hand? But you never call on me when my hand is raised, right? So again, these are getting at that function of attention. So we engage in these behaviors because what then happens is they get attention. I yell and scream and you give me attention, but if I raise my hand, you ignore me, right? I run away from you and you come chase me. That's how they're getting attention. And so those behaviors are going to continue happening. And then finally, we've got Spidey here. who says he's feigning sickness to escape the family function. I'm sure many of us can relate. I did this when I was younger, when I wanted to get out of as a dancer, I wanted to get out of particular dance classes because they didn't like to teach classes. And so when it was my day to teach, I would magically forget my shoes. And so I wouldn't be able to go. And so we all engage in behaviors to get out of things we don't want to do or that we don't like. And so hopefully these are some good examples to help solidify what we mean by function. So in addition to those social functions I just talked about, behaviors can be non-social, and that means that they're just not related to anything that's happening in their environment. So there's not somebody interacting with them, there's not a removal or a presentation of things they like or don't like. So there's nothing going on in the environment that would indicate that, you know, this is happening. So in that sense, non-environmental sources of reinforcement, they can be intrinsic or automatic, something we call internal. When we say it's internally reinforcing, right? It's just something you enjoy. There's no rhyme or reason behind it. It's just something you enjoy. Sensory stimulation. If any of you are hair twirlers or leg bouncers, you know, anything like that, it probably provides you some sort of sensory stimulation that you like, and so you continue to do that. But it can also be pain attenuation. We all itch scratches, and that's to alleviate you know, any pain or discomfort we're having, right? So it's an escape situation, but there's really nothing going on in the environment to suggest that, right? It's just something that's happening to you in the absence of everything else that's going on around you. And so in general, oftentimes these non-social functions or these non-social behaviors per se, they tend to be repetitive. So habits tend to fall into this category. Kids with autism who engage in hand flapping, things like that, it tends to occur in the absence of anything else going on around them. So to summarize, here's yet another meme so assessing for the following behavioral functions. So escape, the dog that's hiding under the curtain. Attention, the dog whose face is in your lap and won't go anywhere. Tangible, the dog who's taking the other, the fun play toy away. And then sensory, or we can call it non-social, automatic, whatever you want to call it. The dog who's itching his behind are all like the main functions we're going to look for when we're trying to evaluate what's going on with these problem behaviors. Okay, so again, the primary reason we assess for function and behavior problems is because it does lead to better matched treatment strategies. So prior to identifying any function, before we had a way to do that, most treatment strategies were actually focused on punishment-based ones, and they were identified most often by trial and error. So for example, in this picture, we've got a little boy whispering to a girl, if you're given a task you don't want to do, just start crying. They'll send you straight to the thinking chair, and it's like a vacation from work, right? So this is just a fun way to illustrate this example. So if we don't understand that these kids don't want to do the task, they find it aversive and they don't want to do it, and that they're engaging in problem behavior to get out of that, when we place them in timeout or we place them in that thinking chair, they're effectively getting out of the task, right? And so they are escaping or they are avoiding, even if just for a little bit, they're avoiding the task. And because we're doing that, that is going to result in the continued occurrence of problem behavior. So now that we have the ability to reliably identify behavioral function, treatment strategies are now most commonly focused on reinforcement-based ones, and they allow for much of the trial and error approach to be reduced, and so that we're identifying things in a better systematic way. So now that we know how to do that, function is now it's all fun and games until someone figures out the function of your behavior, because now we have a way to approach it in a more fine-tuned way that's going to target that function so that they can no longer get those outcomes for engaging in the problem behavior. And I'm going to talk about here in a second is what we want them to do is to still get the outcomes they want, that function, but now because they're engaging in more appropriate behavior than that problem behavior. So what I want to do now is I want to quickly review strategies that are based on punishment and reinforcement. These are common strategies that we use on a daily basis to manage behaviors, and they're not necessarily bad strategies, but it is important to understand what they can and cannot do. So I'm going to start with punishment because it is often a go-to strategy, given that when problem behaviors occur, we want them to stop. So punishment-based strategies, they include things that we do to decrease behavior. Punishment is all about decreasing behavior. So examples are going to include spanking, yelling, reprimands such as no and stop, removal of privileges like screen time and playtime, and timeout is also another very common punishment-based strategy. The benefits, or the pros, if you will, of punishment is that it is effective if it does reduce behavior. So again, we don't ever actually say that a particular strategy is punishing until we've actually seen the effect of the strategy. So if it does reduce behavior, then we're going to say, well, we have an effective punishment strategy. If it doesn't reduce behavior, then we have an ineffective strategy that's based in punishment conceptualization or punishment procedures, but it could actually be a reinforcing strategy. So punishment, we always want to think if it's reducing behavior, then you do have an effective punishment strategy in place. The other benefit, if you will, of punishment is from a parent perspective. The parent is reinforced for using punishment when the behavior stops. And so because the parent is reinforced, they are going, because their behavior, the parent's behavior is reinforced. Putting my child in timeout, if that stops my child's behavior, my behavior of putting my child in timeout will be reinforced. And I'm going to continue using that strategy because in my eyes, it works, even if for a very brief period of time. So you often see that with yelling, right? If we yell at kids, often they like freeze up, right? And they stop and their behavior stop. And so when we yell, that yelling becomes reinforced because it does stop the behavior, even if just for a few moments in time. So we have to think about that. The limitations or cons, though, of punishment are that it doesn't actually teach an alternative behavior. All it does is teach you what not to do. It doesn't teach you what to do differently. And it also, punishment strategies may teach the child ineffective or negative ways to resolve or to solve problems. So if we think about spanking, if we're spanking our children, what it does is it ends up teaching our children that hitting is okay to do. And so when they get into a situation that they feel they need to handle, and I have kids, this happens all the time at school, they hit back, right? But if they're spanked at home or elsewhere, we might be teaching them, inadvertently teaching them that it's okay to hit. And so we have to think about that too. So pros, it does reduce behavior, but it also reinforces the parent's behavior and to continue doing it. And cons, it doesn't teach us what to do differently and may teach us that it's an appropriate way to solve problems. Okay, so then on the other hand, reinforcement-based strategies include things that we do to increase behavior. So examples here are going to include praise and high fives, giving children access to toys and activities or preferred foods, and reducing those task requests. The benefits of reinforcement are that it increases or it strengthens the behavior, and it can be used to teach new behaviors. The limitations are that it can take a long time to see the effects. And it can be difficult to figure out what reinforcers to use. But for that latter point of what reinforcers do we use, if we go back to understanding the function of behavior, that's going to help us identify which reinforcers to use to reinforce those other appropriate behaviors that we're either teaching them new or that we're just now reinforcing because they've already known how to show them, they just didn't do it very frequently. So we're going to strengthen behaviors that are already in existence. Okay, so with this brief review of punishment and reinforcement, in all likelihood, a treatment program is going to use a combination of both types of strategies. We're going to use punishment-based ones to reduce problem behaviors, and we're going to use reinforcement-based ones to teach and increase desired and appropriate behaviors. So when we know the function, the next step is to develop the treatment plan. So in my practice, I primarily focus on antecedent and reinforcement-based strategies that consider behavioral function, because it is the goal that we want to structure the environment in such a way that the child is going to learn that they do not have to cry and yell to get their cookie. And so we want to set them up for success so that we can reinforce those appropriate behaviors and try to prevent or minimize as much as we can the problem behaviors. So antecedent-based strategies, these tend to provide structure for the expectations and can decrease the value or prevent problem behaviors from happening in the first place. So some strategies that you can use include, so if we're thinking about attention, we want to consider providing an extra supply of attention before diverting attention to another task, such as calling someone on the phone or cooking dinner, or if we're diverting our attention to a sibling. When we provide this extra supply of attention, what we're doing is we're trying to, increase their levels of attention that they have, so that we end up decreasing their motivation to seek out the attention in a problematic way, right? So think about, if we think about water, right? So if you are really thirsty and you haven't had something to drink for hours, the value of getting water is going to be increased. So you're going to engage in a lot of behaviors to seek out some kind of fluid to drink. But if you just drank a gallon of water and somebody offers you another glass of water, your motivation to take that glass is going to be decreased, right? And so we have these levels of satiation and deprivation. And so that's kind of what we're playing on in these antecedent strategies of, okay, just give them some extra attention before you need to remove your attention. That can't always be done. You don't know when a phone call is coming in most of the time. And so it can't always be done, but it is one way. If you know you have to cook dinner or you have to get some laundry done and you need them to occupy themselves for a little while you're gone, providing them with some high quality one-on-one attention before you do that can be an effective strategy to minimize the occurrence of problem behavior. Another strategy is to catch the child being good. Seems, like, oh, we should do this. But often parents ignore their children until there are problems that are happening. And then when those problems happen, we give lots of attention to that because it needs to be addressed. So if we can intermittently and, throughout the day or a period of time provide, I like how you're playing, that's really awesome. Keep doing that, things like that. Hearing that they're doing well can also decrease the motivation to get attention, right? Because we're checking in on them. Hey, like I said, we have teachers do this a lot, especially like in kindergarten classrooms, walking around to all the kids. Oh, I love how you're playing. That's awesome. Keep doing it. I'll be right back in a few minutes to see how you're doing. Those kinds of things can help for that attention function of behavior. When we look at toys and activities, Some things to consider would be using visuals, so timers or baskets to assist with sharing and turn taking. And with this, when I think of siblings for turn taking, maybe they have their own baskets of toys. Bobby has this basket and Johnny has this basket. And then maybe there's a shared basket that, there's some rules and expectations around how we use it. Or we use timers of, so Bobby and Johnny want to play the same thing. Okay, so Bobby gets it for X amount of time. We set the timer goes off and we help them work on how to switch, right? So now Johnny has it for X amount of time. So again, putting up those, that structure can be helpful. Another strategy we can use for toys and activities is using, again, visuals to indicate when something will be available. So one thing I like to tell parents to try is having a green and a red board. So if a picture of something or words of something is on the red side, it's not available. And yes, we have to teach them how to use this, but it's not available on red. But then when we shift it over to green, now it's available and you can ask to use it or you can just access it, whatever. So think of snacks. So snacks before dinner are often a common issue we hear from parents. And so, if snacks are not available, put them on the red side. And then when the child asks, hey, can I have cookies before dinner? Let's go check our board and see if it's available right now. We go check the board. Oh, it's on the red side. Okay, so not right now, but on the green side, look, here are some other things you can do while you wait for dinner. And then maybe we have dinner's over, and then you can move snack over to the green side. You might let them know, hey, by the way, if you want a snack, just let me know, on those kinds of things. So again, that structure can be really helpful. When we think about that escape function, we might consider making expectations clear. So using a first then type schedules like here. So put your toys away and then you can play on the computer. The first should always be the task and the then be the preferred activity or item that they will access once they've completed the task. So providing those clear expectations. Pick up these 5 toys and then we will play. And so again, I'm only asking you to pick up 5. I'm not asking you to pick up the whole room. And so just being very clear and explicit on what we want. Providing them with help, but making sure that we don't actually do it for them. So we might do some of it while they're picking up, but we're not going to do all of it because again, if we do all of it, they learn that they don't have to. And so we can provide help, but we want to make sure that they are still completing the task as requested. And then one thing we all do that's challenging to change, but making sure we phrase our task request as a statement rather than a question. So if we say, well, can you pick up your toys? They have a choice and they can say no. And that's an appropriate way to answer a question. But if we say pick up your toys, now we have a statement in place and the expectation is pick up your toys, not can you do it? And so just working on how we phrase things can also be helpful. Okay, so I'm kind of going through the ABC sequence of how we might develop a treatment strategy. So when we think about behaviors, we do want to replace the problem behaviors with the desired alternative. And so we need to think about which ones we want to target. So in my world, in my work, much of the time, the targeted appropriate behavior ends up being communication focused. And we can use communication for everything. We can use communication for attention, right? It can raise my hand. I can say, Mom, come look, or something like that. We can use communication to get toys. We can sign more. We can say just please or more. We can make them more specific. I want my car, please. Things like that. We can also use communication to request breaks or help, right? And so on that escape side of things, I need a break. I need help, right? Those kinds of things. So I always think strengthening communication is really important and one behavior I tend to focus on quite a bit. But there are other appropriate behaviors that we might include. So that might include, so when we think about escaping work, right? Yeah, it'd be great to say, I want a break, but at some point we still want them to actually pick up the toys, right? So another behavior we might be targeting is that you actually pick up the toys when we say pick up the toys. And so we might have to work on that, but we're targeting that behavior specifically. So when we get to the consequence side of things, we're reinforcing when they pick up, or if they need help, if they're asking for help. When it comes to, well, we want attention or we want our toys, sometimes those things are not available. And so we have to learn how to wait and wait appropriately. And so because waiting can be difficult, especially for young children, we might include that the target appropriate behavior is that they are playing with some alternative item during that wait period. And so we work on that. And so being very clear on what behaviors, what alternative behaviors you want, in addition to the behaviors we're wanting to reduce. All right, so then from a consequence standpoint, after we've identified those targeted behaviors, we've thought about antecedent strategies that we might put in place. We do need to ensure that reinforcement is provided for those appropriate behaviors to occur. If we don't reinforce those behaviors, those appropriate behaviors, they're not going to happen. And so we have to reinforce them, and we need to reinforce them with the functional outcome that the child wants. So types of reinforcement that we provide should match the function of behavior. So for attention, for behaviors that are maintained by attention or getting access to attention, reinforcement strategies can be enthusiastic praise and high fives, access to the parent's attention. Those things would be important. I want mom, and instead of hitting mom when I ask appropriately or I wait appropriately, then we want to make sure we give mom's attention because we're now waiting or asking in a good way. For toys and activities, giving access to the preferred toy or activity is going to be important, right? So again, if we're waiting nicely for it or we've asked in an appropriate way, then we want to be able to give that outcome to them because they're showing us the appropriate behavior. And then for escape functions, we think about a break from the task would be important. So this for children, especially young ones, right? So having a break with nothing to do is very hard to do. So we often will use an enriched break. And so this may mean that they can take a break from picking up their toys and maybe they can play with some other toys that are in the room that we're not going to pick up, or they can play games with mom, or do a variety of other things. Or maybe it is just sitting there and doing nothing for a while. And so we take that break. And then if there's more tasks to be completed after that break, maybe we do a little bit more work. And then we come back and we take that break. So those things are going to be important. One thing when we use reinforcement, one thing we want to keep in mind is that it should occur in close proximity to the behavior you want. So the more immediate the reinforcement is, the more likely that connection will be made between appropriate behavior and receiving reinforcement. When it's delayed, there's always a chance that problem behavior is going to occur in the meantime. And if reinforcement follows the problem behavior in closer proximity, then effectively we've just reinforced the problem behavior again, rather than the appropriate behavior. So we want to make sure that when, especially initially, when we're teaching new behaviors, or we're trying to strengthen these behaviors we want that reinforcement to occur pretty close in time to the actual occurrence of that appropriate behavior. Over time, we can work on fading out that reinforcer, but initially we want to keep it close in time. For older kids who have the ability to delay reinforcement, you can use tokens and other strategies like that, those tokens serve as the reminder of like, you're doing a great job. But then at some point, at a later point in time, you'd want them to exchange those tokens to receive the actual reinforcer that they're working towards. Okay, and then finally, so we can do all the antecedent strategies we want, all the reinforcement strategies we want, but inevitably problem behavior is going to probably happen at some point. And so we do have to have some responses of what we're going to do when those problem behaviors occur. So when that happens, we want to respond to those behaviors in a very neutral way to make sure that we do not inadvertently reinforce them. But function does still need to be considered. So for attention and toys or activities, timeout, and the technical term is timeout from reinforcement, is a very great strategy, right? Because it removes access to attention. If it's done in the correct way, we remove access to attention, we remove access to their preferred activities, and so they can't access them when they're engaging in problem behavior. So timeout is an experience. It's not a particular location. It's basically putting the child into a boring place for a brief period of time. It can be a corner, it can be another room, it can be just removing stuff. It can simply be just turning your back to the child for a little while, or just leaving the child where they are, but everyone else leaves. So what it allows for is it allows the parent and the child to calm down. But when we do it, we also want to make sure we're not giving them lots of warnings or threats, because again, this provides attention. Might be negative attention, but it provides attention. And if they want attention in any way, shape, or form, they win when we do it that way. So timeout, it can be used for escape functions, but do think about function, because timeout does allow for some avoidance. And so if you use timeout for escape functions, it's going to be very important that the child comes back to the task and is still required to complete it after they've calmed down. And so again, you just have to be very careful about using timeout for escape, but it can be done. When the child is calm, I tend to not just let them out of timeout when they're calm, but with timeout, sorry, I'm kind of going back and forth a little bit. With timeout, people, will argue use of timers, not. I would say your best bet is to wait till they're calm, rather than just setting a timer, because you can set a timer, and if they're not calm and the timer just indicates they can get up, then again, you're not necessarily addressing the reduction of that behavior. Now, some people will start a timer. If they're still acting up, they'll start the timer over again until they're calm. And so same kind of concept, wait till they're calm. So like I said, I don't let kids just get up from a timeout. I tend to make them engage in an appropriate behavior first, but in addition to being calm, to get out so that I can reinforce that appropriate behavior. So for me, most of the time that becomes using and encouraging the use of communication. So I will remind them, if I know the kid wants my attention, I'm going to say, well, when you're ready to play with me, you can say, play with me. And then when they say that, I can get really enthusiastically excited about it, right? And I'm like, thank you for telling me you want to play with me. Let's go play. And then we move on. If I know they want a toy, I'm going to have maybe them communicate with something like, I want to turn. Or if it's for escape, I need help, those kinds of things. We can also offer alternatives to what they can have. When it's something that, we've said, no, you can't have that. They are, throwing their tantrum. When they're calm, we can then at that point either offer what is available to them. We might show them that red and green board again of what those alternatives may be, again, to get them to shift out of that timeout by using an appropriate behavior that we can reinforce. If problem behaviors do need to be attended to, so it's dangerous to themselves or others, whether that is, climbing on tables and stoves and tops of refrigerators, things like that, or it's, self-injury, they're head hitting, or head banging or things like that. We want to respond in a very neutral way. So we don't want to provide eye contact or discussion. But we do want to keep them safe. So what I do is if a child's on a table, I just simply go up to them and I pick them up and I move them off the table. Maybe I block the table. so they can't keep climbing on it, but I'm not going to talk to them or give them eye contact. I am going to, in my peripheral vision, make sure that they are staying safe while I'm ignoring that behavior. For self-injury, I'm going to block it. So I'm going to get between, I would rather have bruises on my body than them cause harm to themselves. So for head banging, I'm going to get in the way. I'm going to put my arm between their head and the surface, or whatever it may be, just to make sure that they are staying safe. Or if they're like laying down and throwing back, I might put a pillow underneath of them or get them to a soft surface so that they're not doing damage in that way. Okay, so just last couple slides here. So if you've identified the function and you've provided function-based treatment strategies and the parent has implemented them consistently and behavior problems are continuing to occur, this would be a great reason to refer to somebody like me. Other reasons that you might refer to me or someone like me, is that if you can't identify the function based on just the interview alone, that'd be a great reason to send them to someone like me and say, hey, I need you to take a more specific look at what's going on. Or if the parent needs support in learning how to implement the strategies, that's also a really great way to do it. In all of these instances, in the work I do, we systematically manipulate the environment to really hone in on what the functions of those behaviors are. And being able to better identify the function, we can start manipulating components of treatments, of the various treatment strategies in different ways to get at what's going to work best for this individual. And then we also work a lot on coaching parents on how to implement the strategies. Do this, do that. Nope, you're doing great. Don't do it that way. This is great. Keep doing that, right? And we help work through those behaviors of concern. And we can do that in clinic, in person and by telehealth. Telehealth, especially if they're on the younger end of things, are things we commonly do. So with that, I do hope I answered and gave you some ideas to the questions you had coming into this presentation. Looks like we maybe have a few minutes left, and so I'm happy to take other questions. And if you would rather just email me, my email is here on the screen for you. So feel free to reach out and I'm happy to help direct you as best I can.
Great. Thank you, Dr. Schieltz. A wonderful presentation. We'll have time to take a couple questions, so I'll dive right in. A question that came in is there a screening tool used to determine whether to use treatment or to educate?
Oh, that's a great question. So I'm not aware of any screening tool that's going to help you determine whether to educate or treat. I would say if you keep in mind what our typical developmental, what's, typical for development, and use that kind of as your guide, that's probably a good way to go. But I also think, there's sometimes it might seem typical, but if parents seem really distressed by it and don't know what to do, like offering, strategies, even like self-injury in a small percentage of kids is common when they're really young. But I'm also not going to just sit there and wait till they grow out of it. And so you can always still offer strategies. You just might not have to do as big of a dive into function as you would with something else. So I don't know if that particularly answers, but maybe a little bit.
Great, thank you. And then maybe one more. What are ways parents can help with issues that are behavioral issues that are happening like in a school setting where they wouldn't have as much control over the reinforcements and things like that?
Yeah. So when behaviors are happening at school, what I tell, always understanding function can be important. There's not a lot parents can particularly do, although they can suggest like what works for them at home if they've found strategies. We do keep in mind, though, that behaviors can happen for different functions in different environments. So it might happen for one reason at school and a different reason at home. And as I was talking about throughout today, right, that would constitute maybe different treatment strategies. So we are careful in that way. but they can offer things that work for them at home. The other thing is there are all the area education agencies in the state of Iowa. We train them all on, or not, we train people in all of them to think about behavior functionally. And so there's teams across the state that teachers can tap into for further evaluation and to help guide them on what a treatment strategy might look like for a kid who's causing a lot of concerns that the school's unable to handle, that they need more expertise for.
Great, thank you.
Yeah.
So it looks like we're at 1 o'clock, so I'll just cover a couple things before we close. This course was certified for AMA PRA Category 1 credit. Attendees will be eligible to claim continuing education credit by completing the evaluation and attestation form and downloading your certificate of participation. I've attached the step-by-step instructions in the chat. I'll also send it in the follow-up email. And if you do have any questions, I will put my information into the chat, my email address. So don't hesitate to reach out. So in closing, I just want to thank Dr. Schieltz for presenting today and sharing this valuable information. And I'd like to thank you all for attending. Have a great afternoon.